Narcolepsy is a neurological disorder that affects the control of sleep and wakefulness. People with narcolepsy experience excessive daytime sleepiness and intermittent uncontrollable episodes of falling asleep during the daytime. These sudden sleep attacks may occur during any type of activity at any time of the day. In a typical sleep cycle, we initially enter the early stages of sleep followed by deeper sleep stages and ultimately after about 90 minutes rapid eye movement sleep. For people suffering from narcolepsy, rapid eye movement sleep occurs almost immediately in the sleep cycle, as well as periodically during the waking hours. It is in rapid eye movement sleep that we can experience dreams and muscle paralysis, which explains some of the symptoms of narcolepsy. Narcolepsy usually begins between the ages of 15 and 25, but it can become apparent at any age. In many cases, narcolepsy is undiagnosed and therefore untreated. What causes narcolepsy? The cause of narcolepsy is not known. However, scientists have made progress toward identifying genes strongly associated with the disorder. These genes control the productions of chemicals in the brain that may signal sleep and awake cycles. Some experts think narcolepsy may be due to a deficiency in the production of chemical called hypocretin by the brain. In addition, researchers have discovered abnormalities in various parts of the brain involved in regulating rapid eye movement sleep. These abnormalities apparently contribute to system and symptom development. According to experts, it is likely narcolepsy involves multiple factors that interact to cause neurological dysfunction and rapid eye movement sleep disturbances. What are symptoms of narcolepsy? Symptoms of narcolepsy include excessive daytime sleepiness. In general, excessive daytime sleepiness interferes with normal activities on a daily basis, whether or not a person with narcolepsy has sufficient sleep at night. People with excessive daytime sleepiness report mental cloudiness, a lack of energy and concentration, memory lapses, a depressed mood, and/or extreme exhaustion. Cataplexy. This symptom consists of a sudden loss of muscle tone that leads to feeling of weakness and the loss of voluntary muscle control. It can cause symptoms ranging from slurred speech to total body collapse, depending on the muscles involved, and is often triggered by intense emotions such as surprise, laughter, or anger. Hallucinations. Usually, these delusional experiences are vivid and frequently frightening. The content is primarily visual, but any of the other senses can be involved. These are called hypnagogic hallucination, when accompanying sleep onset, and hypnopompic hallucination when they occur during awakening. Sleep paralysis. These symptoms involve the temporary inability to move or speak while falling asleep or waking up. These episodes are generally brief, lasting a few seconds to several minutes. After episodes end, people rapidly recover their full capacity to move and speak. Diagnose. A physical exam and exhaustive medical history are essential for proper diagnosis of narcolepsy. However, none of the major symptoms is exclusive to narcolepsy. Several special tests, which can be performed in sleep disorders, clinic, or sleep lab, usually are required before a diagnosis can be established. Two sets that are considered essential in confirming a diagnosis of narcolepsy as the polysomnogram and the multiple sleep latency test. The polysomnogram is an overnight test that takes continuous multiple measurements while a patient is asleep to document abnormalities in the sleep cycle. A polysomnogram can help reveal whether rapid eye movement sleep occurs at abnormal time in the sleep cycle and can eliminate the possibility that individual symptoms result from another condition. The multiple sleep latency test is performed during the day to measure a person's tendency to fall asleep and to determine whether isolated elements of rapid eye movement sleep intrude at inappropriate times during the waking hours. As part of the test, an individual is asked to take 4 or 5 short naps, usually scheduled 2 hours apart. How is narcolepsy treated? Although there is no cure for narcolepsy, the most disabling symptoms of the disorder can be controlled in most people with drug treatment. Sleepiness is treated with amphetamine-like stimulants, while the symptoms of abnormal rapid eye movement sleep are treated with antidepressant drugs. There has recently been a new medication approved for those who suffer from narcolepsy and cataplexy. This drug, called Xyrem, helps people with narcolepsy get a better night's sleep, allowing them to be less sleepy during the day. Patients with narcolepsy can be substantially helped but not cured by medical treatment. Lifestyle adjustments such as avoiding caffeine, alcohol, nicotine, and heavy meals, regulating sleep schedules, scheduling daytime naps, 10 to 15 minutes in length, and establishing a normal exercise and meal schedule may also help to reduce symptoms.